Let's turn now to our medical correspondent, Dr. John Torres, and NBC News contributor, Dr. Joseph Fair, an expert on the study of viruses, who was on the front lines of the fight against Ebola in Africa. Doctors, good morning. I will start with you, Dr. Fair, this morning, because a lot of people were stunned to see this projection from the White House that estimates 100 to 200,000 people, Americans, could die. And that is if everything goes right. If social distancing is executed exquisitely in all 50 states. Is that happening right now?
Absolutely not. I mean, when you see on the map of states with full state lockdowns, and then you see the map with partial state lockdowns, and then you see the states with no lockdowns, until all 50 states do it, and they all do it at the same time, it's really kind of a moot point. As we talked about, those are best case scenarios with everyone doing the same thing. That's only going to happen if all 50 states are doing the same thing. That's why I'd really urge, the Association of Governors to get together, everybody get on the same page as far as what they're going to do, and everybody implement the same measures strictly across the states.
The other question I had is, and I think we just put the chart up there, and it shows the big peak that we're trying to avoid and then the flattening of the curve that we're hoping for. It's suggesting, okay, we can keep that curve low, keep those deaths hovering around 100 to 200,000, staggering that we're even talking in those terms. But nevertheless, does the social distancing, if it ends on April 30th, as is the current scenario, would that be enough? Or in all reality, does social distancing need to go on for longer?
Realistically, I think it's going to have to go on for 6 to even 10 weeks. And again, it goes back to...
Total or from now?
Yeah, absolutely. And that's if everyone starts today, right? And so, again, it goes back to if everyone's not doing it, there are still going to be people out there spreading it. There are things we're going to have to do. We have to go to the grocery store. We have to go to the pharmacy. There are people that are working in hospitals, et cetera. But we can all do our own part, and everybody has to do it. And frankly, I even think we need to get the police involved in it, just as far as implementing strict distancing measures. If you see people crowded together, have them start breaking it up.
Wow. Okay, that was pretty riveting. Dr. Torres, let's talk to you. Yesterday at the news conference, the president talked about maybe Americans should wear some kind of mask or bandana. He said, don't use the masks that the health professionals use. What do you think about regular, everyday Americans getting some type of face covering during this time?
Really important.
And what you're hearing here are two sides to this debate. One side are the CDC and World Health Organization saying that the general public doesn't really need to use them and probably shouldn't use them. With the other side, you're hearing from the president, in fact, saying, let's wear scarves and it doesn't hurt people to use those. Last night on the special that you guys hosted, Dr. Fauci actually said something pretty interesting. I think it's good to bring up. Those masks, what they're looking at doing is telling people to wear those masks because they protect people who are sick or who might have it and are asymptomatic from spreading it to other people. They're not looking at it as far as people protecting themselves from getting it. And so I think that's a big thing to understand. And they're looking at it very heavily right now. And my guess is at some point they're going to go ahead and make a recommendation that people do wear things like that, but save the surgical masks, save the N95 masks for the healthcare workers and the frontline workers because they need them. But as far as the other ones, the World Health Organization has said there are some studies saying that they might make things a little worse and more likely to catch the virus because people get a false sense of security and they get within that 6-foot perimeter that we want to keep away from each other. But at the same time, they could offer a little bit of protection.
And Dr. Torres, a lot of my friends have been talking about this. They're afraid to go to the grocery store, the drugstore. They're wondering how contagious is this? Are they putting themselves at risk when they leave their home and go out, even for a short period of time?
So anytime you leave your house and you go outside, there could be people out there that are either sick or they're asymptomatic. They don't have the symptoms, but they do carry the virus. And so getting that 6-foot distance is important. If you go to the grocery store, if you go shopping, it's going to be hard to do that. And so you are putting yourself at a little bit of risk every time you go out and do something like that. And that's why we say, number one, if you're out and about, make sure you keep as good as you can that 6-foot distance. And when you get back home, wash your hands, especially before you touch your face. And that's kind of the best you can do because there are some instances you're going to need to go out and there are some things you're going to need to do. But at the same time, you want to make sure you protect yourself as best you can because it is adding a little bit of risk every time you get out there.
All right, Dr. Torres, Dr. Fair, thank you as always. It's good to have you with us. And get that soap lathered up and really scrub them. I've been having to go over it with my kids and even remind myself. Scrub under the fingernails and in between.
Right. And when you don't, we got this right here, too. Taking care of business.